that province has seen a number of protests, whether it is from doctors who are seeking employment all the way to public servants working in the healthcare space. I can remember the Mshieni Hospital, including other hospitals in the township areas. Where are you exactly, and what are the problems there?
I'm currently in the area of Kenville at the informal settlement here, and I'm actually here to have a chat with someone who is a family member to someone who has cancer and forms part of the oncology department within the public healthcare system here in KwaZulu-Natal, but has been facing a number of difficulties. And like you mentioned, there's a number of issues here in KwaZulu-Natal. Like you mentioned, the issue of the doctors, even pharmacists. We've seen a number of protests, and just recently there was that issue of a shortage of medication, and earlier we did speak to the Public Servants Association around, you know, what they would like the minister ahead of that briefing to touch on, and they mentioned the issues of just outside you know, of the issues that patients complain about, but there's also a number of issues where there are a number of acting CEOs in hospitals, and those vacancies haven't been filled. They spoke about the issue of security contracts that haven't been paid. That puts the lives of patients at risk if there's no security personnel at the facilities. They raised a number of issues around, you know, the medication shortages as well, saying that if this is not dealt with, you know, immediately, then there will be an outbreak of TB and there will be a serious problem. So there has been a number of issues here in the KwaZulu-Natal province. But like I said, I do have with me someone who is a family member to someone who has cancer and has had to go through Addington Hospital, which we understand has had an issue, number one, with the device that they use for chemotherapy. There's also quite a large backlog in terms of patients who need treatment. And he's just going to take us into the story with regards to his sister and what they had to go through. I mean, he's not only complaining about the state of the hospitals, but just complaining about the processes to the point where his sister, the cancer spread, and by the time she needed help and they took her to a specialist hospital, Inkosi Albert Luthuli Hospital, it was too late. They couldn't treat her, and she's had to go through Addington, where at the time they were having issues with the machinery. So I want him to narrate to us exactly what the issues are within the public healthcare system, particularly when it comes to patients who have to go through the oncology department. Siyabonga kakhulu Lindani. Ngicela usichazele mhlawumbe ukuthi wena inkinga yakho particularly with your family member yini when it comes to ibhedlele ne condition kasisi.
Ngiyabonga Mr. Modise, ngizwakalisa kakhulu ungaphatheki kahle ngendlela ekusebenzeka ngayo ibhedlela especially lezi zikahulumeni. Usisi wami utholakale last year very early ukuthi une cancer Prince Mshieni. Bamhlalisa almost a year up until bamthathe nge-28 zika October bathi akaye eAlbert la kuyena ekutreatwa khona icancer. Uma efika khona bambuyisele emva bathi igazi akanalo. Wabuyela eMshieni, they take another month ukuthi bambuyisele back eAlbert ukuthi isenegazi manje sekufuna bayotreata le cancer. Uma sefika after that month useyafika sekuthiwa manje ngathi sesikhule kakhulu ngaphakathi. Insasho ukuthi abasakwazi ngeke basakwazi bona kuyitreata njengeAlbert. Sekufuna bamuse eAddington. Bamtransfer eAddington. Abamtransfera nga same time. After another 2 months, bamse Addington. Addington wafika nge-27 zika February lo nyaka. Imshini ifile, kuthiwa iphukile. Bafanele bamphindisele back ke manje to umshini ayohlala khona, alinde up until they fix imshini. Imshini kayilungi ke Addington Sis Modise, up until now ayikazi ilunge. And iworry yami isekuthenini imshini njengoba kuthiwa iphukile and leyanto kuthiwa isikhulile ngaphakathi kuyena, and yena wavuma ukuthi bangasithatha isibelotho out because manje asa prepared ngokuthola izingane vele usenazo izingane enough, which is isibhedlela okufanele sikwenze same time ukum-assista. And isisi Modise isifo esibula dangerous lesiyingozi. Bahleli nje they not even worried. I tried to phone all the relevant people that you think ukuthi ba in power, like Muzi, PRO of Prince Mshieni, Uthabiso, All those people, they couldn't help me. Abakazi bangisize ngalutho. And usisi wami is still lying at Prince Mshieni. Balo bemthatha each and every day during the days. Bemse Eddington, I don't know for what. And batha ukumphetho kulala yena Eddington. Uhlele Mshieni, balo bemehlisa bemenyusa. So I'm very worried as a South African. Masoba nezibhedlela ezofana nalezi ka-government. Zomuntu esimvotele sambeka lapha to get assistant while they were not getting assistant. And ngiyabawonisha ukuthi they mustn't ukuthi baloku beyiqhuba beyenza lento because I don't know ukuthi kwenzakala njengamanje njengalaba abanye because isibhedlela sinyakaze ngoba senginyakazisa iminyaka engithize mina wayimanxa sinyakaza for usisi wami. What about labantu abawu2 abanye oyihamba nabo abangenabo abantu abanyakazisa but ama South African voters kwenzakalani ngabo? Should bona bahleli they still lying lapha ePrince Mshieni abalithola usizo kule ibhedlela zika government. And they always taking her back at home bethi ayikho indawo yokulala. Even ngisho Mshieni bamthathe back ekhaya bamgodukisa bathi ayikho indawo yokulala imbhedlela imbhedi igcwele. How can you say to umbhedi ugcwele kumuntu ogulayo on a serious isifo esifana nalesi? That's what I'm worried as a South African ukuthi kulesikhathi esiphila kusona mawungenayo lento ekuthiwa i-medical aid ukuya kuma-private hospital esibhedlela za-government asisizakali. Ngiyabonga.
Ngiyabonga baba. That is Lindani Ndimande, who is a family member to someone who has cervical cancer, and he's just, telling us about his experience with the public health care in KwaZulu-Natal. And as you've heard there, he raised a number of issues with, number one, the fact that his sister was being moved from pillar to post and not being assisted when she needed to. And when she was first diagnosed, she also had to wait a long time before she could receive any help. Also speaking to the fact that at Addington Hospital, when she did eventually have to go there, the machines were broken and she's been lying in Prince Mshieni Hospital without any movement, and he doesn't know, where to go from here. And this is just an ordinary member of the public who's just concerned about the way, patients are treated in public healthcare facilities, especially when it comes to those who have, things like cancer, where if it's not dealt with in time, the outcome may not be a desired one. But for now, I'll throw it back to you in studio, Oli.